Right. Thank you for
This meeting is being recorded.
Thank you for inviting me. It's an absolute pleasure to be at home doing this for fellow Ontarians and fellow BFI and Ontario members. So, navigating staff competencies is the topic for our little quick speed dating lunch and learn type of presentation today. We do have acknowledgements of my own that I'd like to make, just to thank Andrea Fermani and Sarah Frittenberg from St. Paul's Hospital in BC, from whom I borrowed some slides, and also Mark Lassalle, who worked very, very much with me over the years, but especially when it came to the document that we'll share with you, which is an attempt to synthesize down the competency guidelines into a more usable format. So thank you to all. So step 2 is about staff competency and ensuring that staff have the knowledge, attitude, and skills necessary to support moms and birthing parents to meet their goals.
Kathy, could you
yes.
put it into the slideshow mode? Right now we've got all the slides up.
Oh, I thought it was already in that mode. I beg your pardon. That's no good. I did press my little knob down there. Is that any better?
No, it's still.
Why? Why? Righty, let me just see what's going on. I'll just share again. These things happen. Oh my word, maybe we have to do that before we share. Nope. Oh, come on, view. Give us this thing now.
If you go at the top, Kathy, you'll see some tabs and it'll say slideshow. And if you click on that, it'll say start at beginning slide.
Oh my word. Okay. Are we good? Can you see it?
No.
All right.
I don't think you're not sharing yet.
Yep.
Maybe on.
Okay, hang on. I was sharing. Do you know this is enough to drive a person to absolute drink? Okay, that I won't do, but you know. All right, you should be able to see something now. Yes?
Yes, but we're still just seeing.
So if you go,
if you're from the beginning.
So see at the over the far left, it says from the beginning. Click on that.
One more.
Nope, to the left. Nope. Yep. Click on that.
Now?
No.
Yeah. Click on from the beginning.
I did several times now.
Oh.
You know what? Why don't you just bring it up and then you can change slides for me, because it's obviously not going to work.
Sure. No problem. Let me do that.
Okay. It's so annoying. I beg your pardon, everybody.
That's okay. This is sometimes issues that happen.
I got it, Kathy.
Thank goodness I sent it to you in advance.
Yeah, no worries.
Okay. Maybe we should start that from here, and I'll start the whole thing again.
So let me do here. And then from
Thank you for your patience, people.
Okay, oops. Let me do it this way. Okay, share screen. There we go.
I'm just looking at all the people that are in attendance today. It's so nice to see you all.
There we go.
Okay, thank you.
Can everybody see that?
Yep.
Great.
Okay,
so I'll
excellent.
just say,
you just cue me when you want me to change.
All right. So we brought to the table the navigating staff competencies, because that's what everybody is sending queries to the BCC about. And I'm sure that when you work with facilities and in facilities, you know that the staff competencies are the biggest part of our implementation of baby friendly, for sure. Next. And I did thank Mark and Andrea and Sarah previously for their contribution. Next. So how do we do this? How do we look at what is required to ensure that staff have the right attitude, knowledge, and skills to be able to be supportive and to help people get started well? How do we make this happen within our facilities, whether that's public health or hospitals? Next. We do have some documents, some guidelines, and you'll know that in 2018, when the new WHO guidance document came out, their implementation guidance is a very well researched, massive collection of evidence-based practice for the implementation of baby friendly, reiterated through randomized controlled trials. The evidence base is there for each of the 10 steps. So when we see that huge document and we see the Breastfeeding Committee for Canada synthesized that and made it our own, as countries have been instructed to do, we used that opportunity to integrate the new WHO stuff when we reviewed the Breastfeeding Canada implementation guideline that was published in 2021. We also have, following on those two documents, a competency verification toolkit from WHO. So those three huge documents all talk about the knowledge and skills that are required by staff of different categories in terms of what's expected from baby friendly. And the tricky part is not being overwhelmed by all of this. So we are going to try to help clarify things a little bit. Next. The main thing that we really wish for you to get out of today is the understanding that we've already done this work for you. So not only in Canada, we have not only the hospital BFI, we also have the community. And so we took the competency document from WHO for our hospital guideline, but then we synthesized it so that it works for the community as well. And that's what this document is in front of you. So we're thinking 2 documents from Breastfeeding Committee for Canada. Next. So remember now we've got the 3 documents, 2 from WHO, 1 from Breastfeeding Committee for Canada, and that one from BCC includes the piece for the community. It's a lot. And I think that when you are trying to decide who needs what education and where to get it, it becomes a bit overwhelming and creates a bit of anxiety. The thing about the new documents is that it's still the 10 steps. We still require the same basic knowledge to be given to staff to be able to help parents. Nothing major has changed, right? The evidence base, the strength of some of the steps has become less and some of them have become more, dependent on the evidence base. But the 10 steps remain the 10 steps, right? So your BFI implementation guideline and your BFI checklist are the 2 things that you can count on have synthesized all the stuff from the WHO. So this is what Mark and I sat together with, and we thought about how can we make this simple and doable, achievable, relatable. So we created some guides, and what we thought about was where can we synthesize it all together so that we get a list of what actually do the staff need to know, what's the basic things they need to know, and then to reflect those basic pieces of knowledge to the source documents so that you can have your evidence base, right? So if you could make that a little bit bigger, let's just have a look, see. You'll see that the key knowledge questions for direct care providers is on the left-hand side there. And as we go through step by step, you know, what would we look for in an assessment? We would want to know that there's a hospital policy that's accessible to the parents, that is updated regularly, and that all the staff know that there's a policy. And if we're coming to do our interviews, we're going to ask, one of the questions we ask is, do you know where to find this policy? And can you give us 1 or 2 things that it says on the policy? So as we worked through our BFI guideline checklist, Marga and I selected those key pieces of information that we want you to focus on, right? And then when you look in that second column, you'll see where you can find the nitty-gritties. So we are referring to things like the guidance document from WHO. We're referring to the global strategy for infant and young child feeding. But if you keep going back to your implementation guideline and your checklist, you've got the breakdown of exactly what it is for each step that the staff need to be able to be aware of, right? And you'll see on the far right of your screen there that there is a column that just tells you which step these things belong to. So step 1 is all about the policy, it's all about the code, right? And as we move down through step by step, the pertinent questions and the pertinent skill sets are in those columns. If you wanted to find the rationale, the evidence base for something like safe skin to skin or hand expression, for example, then you would go to your implementation guideline, you'd have a look at the checklist, and it would tell you exactly what it is that the staff need to know. Nothing major has changed. It's just that it all looks a bit much when you look at all these accumulations of documents that have landed with us. So if we could go to the next slide, we're going to try to just explain a few things. When it comes to figuring out what you need in your facility, you first have to find out where you're at. So your BFI checklist gives you the opportunity. It goes through all of the stuff that staff need to know, and you can check off quickly, you know, yes, I think they're doing this. No, I don't think they're doing that. We need an update on this. We need an update on that. So that gives you a bit of a framework if you're the lead who's trying to figure out what do we need. The next thing that is really helpful is if you survey your staff. So being able to hear from them what it is they feel they need helps you once again to focus down and see where are the big buckets of learning needs coming. What is it that they really want to know? People think they know a lot, and people generally do know a lot. Nowadays, there's a higher baseline of knowledge, but you'll see that there are pockets that are more commonly asked for. So if you can get it from the staff themselves through a survey or whatever, however you do it, a quiz, then you focused it right down and you can target your education to those main competencies. As you provide information and you look for changes based on the information that's been shared, you may start to see changes in confidence in the staff, changes in their practice. Then we can fill in the gaps of the other pieces that you might think still need to be focused on. So we are looking now not at 20 hours of breastfeeding education, but quality. So what do you need to spend your time with? Focusing on the needs that you see in your facility, what your staff need, not necessarily pushing everyone through a 3-day course, because we know you can do a 20-day course, but what knowledge transference there is really the important piece. So it's adult learning principles. We know if we ask people what they want, and then we can start at that point, we can always use opportunities to fill in the other pieces to meet what's required in terms of the BFI. Next, please. It's all about quality, not quantity anymore. So, you know, we need to know where we start, to know where we want to go, and that exploration helps us to identify some of our deficits and to discover some of our practice gaps, perhaps, and also to see who our strengths are. So we can find champions in our groups by surveying our people, right? So what we wanted you to know is that you don't have to use a specific course. You can keep the courses that you've already developed, the things that are familiar to you. You just need to take that work and make sure that when you look at the BFI checklist, that you've got in that course the main concepts that the BFI checklist is asking you for. And then your education can be done in, you know, a course, whether that's 1 day, 2 days, 1 hour, lunch and learns, huddles. It doesn't matter how you offer those bites of knowledge, as long as when you look at the whole thing, you've provided the baseline that some of those, that the competencies that are demanded for are actually there. So you can use what you've always been using. Just make sure that your stuff is updated in terms of the research that backs the things up that you're teaching, and that you realize that it, you know, there's not one thing that works best. There are different ways to impart knowledge. There's different ways that we learn. And sometimes you're required in your facility with your own circumstances to pick many different ways of imparting the knowledge. Next, please. With BFI today, it's about quality improvement, right? It's so much different. It's so much healthier to approach what we're doing in terms of baby friendly through a quality improvement lens, because everybody's meant to benefit from BFI, whether that's the staff or the parents, whether they're breastfeeding or not breastfeeding. We're getting better basic practices that should be in place, and we're able to measure them to see that we're actually doing a great job. And we can keep coming back to the places where we're not doing such a great job, changing things, tweaking things, measuring again, and seeing if we're moving forward. So how you create or deliver your learning opportunities depends on your staffing, who your champions are, what the needs are. You know, whether it's virtual or in-person education doesn't matter. The 10 steps are still the 10 steps, right? Mentorship or clinical competency workshops, it's all about, can you actually do the job? Do you know how to encourage prenatally the value of breast milk? Do they know that? Do they know how to talk about hand expression? Do they know how to teach it? Do they know why we do try to collect those tiny drops of colostrum? Do we know how important skin to skin is? How do we vocalize that to our clients, our patients? And are we able to do skin to skin? Are we able to support safe skin to skin care in a way that everybody stays safe and confident in that? So as you work your way through, whether that's helping parents to learn how to latch their babies, signs of effective feeding, you know, cues, learning about cue-based responsive feeding, whether you're in the community and you're dealing with small challenges or big challenges like sore nipples or milk supply, that you've got this basic grounding, and you know, if you don't have the answers, you know where to send people, you know what your local resources look like. So you know BFI is still BFI, your courses are still valuable, the ways you've taught things are still valuable. The only thing that we want you to know is that the competencies outline things. They have looked at, the competencies have been looked at through an evidence-based lens so that you know they're still good, and that you are going to focus on those specific competencies rather than the number of hours of teaching that you've given people. Next, please. Once you do your teaching, however that looks, then we need to make sure that everybody feels as though their learning has made them more confident and more competent. So, you know, there is one thing I wanted to bring your attention to. So Marg and I created that document just to synthesize it down. So it's a much simpler list of things the staff absolutely have to know. But then there's the supporting stuff you can go to if you are trying to create tools to assess your staff, for example, or to do a session on something. This WHO competency toolkit has really cool things in it. You know, there are multiple choice questions, there's case studies, there's observational tools and checklists that you can take and use. There's even spreadsheets there. These documents are not just PDF, they're in usable formats so that you don't have to reinvent the wheel. You can make them whatever you need them to be. There are staff surveys that BCC has created that you can take, and you can tailor make it to ask exactly what you wanted to ask, you know, depending on which pieces you are trying to nail down. You can utilize the tools that the BCC have made and the tools in the competency toolkit from WHO without reinventing the wheel. Next, please. Don't reinvent the wheel. There's so much stuff out there. You know, the BCC doesn't endorse any one particular course. You know, there's many out there, right? There's a list, a little bit of a list of things that were created by the BCC on the website, and you can have access to those. Next slide, please. But your most important resource is your BCC implementation guideline. The document that you'll be given after this little session has links on it to really trusted sites that have got their principles and their ethics are aligned with the BCC and Baby Friendly. So you'll see Global Health Media is on there, and Stanford University's site is on there, because there's such great resources there. And on the BCC website, you'll find, you know, webinars that have been recorded. There's little video clips on different topics that are on there that you're welcome to, that have all been developed by people from the BCC. And there is even an amazing Jeopardy game. And so Mark did a lot of work making this offering so that you can actually have each of the things we've put on that list of things staff absolutely have to know. There's little Jeopardy questions. You can have a game that can be multiple user or single user, and you can play with it. You can learn in so many different ways. So there's one for direct care staff, and there's also one for indirect care staff. And if they play the game, they're learning all the time. It's a little bit competitive, and it doesn't cost you anything. So we would encourage you to use the stuff, because we've looked at these documents till we're blue in the face, so you don't have to. And we've synthesized it all down so that you can just concentrate on. Imagine if all our staff just knew these small basic things, what big changes there would be for our patients, right? So don't be overwhelmed by the huge tools that are around. They become a little bit overwhelming. Sometimes we're confused about which one should I go to. The wording is not always consistent, but the principles are consistent. So we want you to please relax about the competencies. Know that competencies just mean that you actually can practically turn the theory into the practice, so that our clients, our patients, have better support at the bedside or in the community. When you have little time with them, then we really want to focus on the really important stuff. And that's what we've tried to do in our efforts to synthesize everything down for you. So you'll get that list. Is there another slide? I have a feeling we've come to the end. I think we're almost done. Oh, so there's the bottom line. Your primary tools for implementation of BFI for the competencies are your guideline checklist and your implementation guidelines. So those BCC documents, the work has been done for you. Keep using your existing breastfeeding education. But just modify it if you need to modify it. You can cut it up into chunks. You can serve it as a mixed salad. You can do, you know, focused intent on a specific topic. It doesn't matter how you do this. What matters is that people get the practical skills out of it at the end of the day. Next, please. I think I've probably come to the end of my time, but we've got hospitals and healthcare facilities, public health units that have been through what you're going through. Not everybody does BFI because they want to be designated. We do BFI because we want to offer good, solid, best practice so that we can help people meet their goals, right? So this is just one facility that found a few lessons learned from implementation of the tools that we've given you there. And that is to think about how it affects the patients. You know, what is the outcome for them? What is the focus? And find your champions that you can farm out little pieces of your education to. They can do this teaching. Not one person has to do it. And start with small changes that you know will make an impact. You know, people will very often start with hard things, and it's a bit depressing. Start with the simple things that gives a bite, that gives gain for everybody. Something like skin to skin, for example, something simple. Or do something about, you know, supplementation, like when you have to chart and for the born record for purposes of documentation. Are we charting when it's a medical reason for supplementation? Or does our staff kind of put everything down to parent request or parent decision? You know, we're losing so much solid information when we don't know how to interpret the situation correctly. So you could start anywhere, looking at things, and dishing up your education appropriate to the need. But you first have to assess what is your need. So go back again, look at your BFI checklist, and then grab your little document that we created for you, and just do a quick sweep. And then you can go back and do a deeper dive later. Next, please. So that's the end of my story. I just want to give you that reassurance that Mark has sent. I think we sent the document to you, Louise, so you can share it. But there's all sorts of help for you out there. You've got lots of people who are willing to help you sort through the mess, and lots of opportunities to get education in multiple different ways. It's so much easier today working on competency focus rather on X number of hours. So you really get better bang for your buck that way. When you've got little staff, and you've got little time, and you've got even less money to spend on this, then we need to do it in the most cost-effective, most sensible way we can. Is there anybody who wants to ask questions? It kind of is a bit like speed dating there once we got started. So please don't be freaked out by the competency discussion. It's still the same 10 steps, right?
Yeah. I don't see any questions coming up in the chat just yet. I have a question. I'm just going to ask Kathy. So what I'm gathering from your presentation here is that so to look at staff competencies, what you're suggesting is that they go to the checklist and look at what is listed there as what the staff competencies are. And would you suggest like doing and making a survey just based on what is there? I'm just sort of,
yeah, you could do that. You absolutely, because you want to know what do they need to know. You want to know, do you know these things? If I'm a new nurse and somebody said to me, we need to assess where to put our education dollars. Could you look at this checklist and tick off the things that you're not sure about? So you could take that simplified document that Mark and I provided for you, because in the one column, you've got all of the questions. You could simplify that down, make that your survey, and say, could you tick off the things you would like us to spend some time on, right? Or you could break it up and do step 1 and step 2 this week. Tell us what you'd like us to spend time on here, and then the next week you do another few steps. You can take these tools and make them what you want, but what we want you to know is that both the checklist, the BFI checklist, and the document that we've given you that Marg and I put together, they're speaking to the same thing. It's just that the one that Marg and I made really simplified it down to absolute essentials. So you can do a quick scope, you know, and then you can see, oh my goodness, they really don't get skin to skin. Let's do a deeper dive. Let's go and see what the implementation guideline is asking us to do in reality. And you can do back and forth, you know. So don't freak out. Take pieces of it. Utilize it the way it works best for you. And if you're still a hell of a confused person, like mostly I am, then, you know, there's people you can talk to, right?
Okay, so what I'm hearing is that the document that you and Marg developed is on the website, but it's a little bit different than the original BCC document. Is that right? Maybe I haven't come across it.
It's just an extract. It's an extract from.
Okay.
Yeah. It's just a tool to say to you, you know, here's something that you might find useful. Because everyone has the same concerns. It's just a lot of documents all talking about the same stuff and all have checklists. So you just don't know where are the differences, where are the similarities. So we synthesized it all down to that simple little format. And then you've got the source documents if you want to do a deeper dive.
Right. Okay. Does anyone else have questions before Shannon moves on here? I'm just going to, I don't see any other questions. People could raise their hand or
please just be in touch, because you know, you
Okay.
can get to us through Mark, you can get any of you guys on the BFI Ontario board, you can reach us, right?
Yeah. Okay.
Thank you for letting me share. Have a good meeting, folks.
Okay. Thank you so
Kathy.
much, Kathy. I
Thank
really
you.
appreciate all your help there in helping us to understand this. I'm going to stop recording.
Thank you. Bye-bye.
Bye.